Good evening and thank you for keeping it TV 47. You are just in time for Body Garage with I, Sheila Chelangat, where on this episode we are focusing on respiratory illnesses in children, specifically the upper and lower tract. And with me is Dr. Aura Nzinga. How are you, Dr.?
How are you, Sheila?
I am doing good. How are you doing?
Thank you for having me. I'm doing well.
Could you introduce yourself to us?
So my name is Dr. Aura Nzinga. I'm a pediatrician. That's a doctor who specializes with the care of children. Children are people below the age of 21 years.
And so it's important to highlight.
Yes.
Because I can say I'm children.
You can say you're children. Many adults, adulting has been hard. Many want to identify as children.
Yes.
So yeah, 0 to 21 years, that's my cohort.
Perfect. Now we are focusing on respiratory illnesses and it affects the upper and lower tract. So where is that first in the body? What does it comprise of? And what causes this, illnesses? Okay.
So first, let's define what respiratory illnesses mean. So respiratory basically means anything that is associated with air. With breathing, because respiration means breathing. So anything from the nose, the mouth, into this part we call the larynx, feeding into the larger airway that we call the trachea, then it divides and the air goes into our lungs. So that's basically what the focus of respiratory illnesses are. And when you talk about upper and lower, it's again divided based on the anatomy of all that.
Yes.
So from the upper, we talk about anything that affects the nasal airway, the mouth. They have a connection that feed into a part we call the pharynx, that also feeds into a part we call the larynx, and then now the trachea. So we divide it there at the larynx. For anything above that, we call it upper respiratory tract, and then everything below that, we call it lower respiratory tract.
It's quite a biology class here.
It's a biology class, it's an anatomy class.
Yes. Now, we're talking about let's start with, the upper infections, respiratory infections. What are they and what causes them?
Good question. So basically, I can just maybe highlight a few and then we can talk about how they occur or what happens. So first, for us to call it an illness, it's a deviation from the normal. So maybe a child who is sneezing a lot, coughing a lot, a dull child, a child who is having difficulty in breathing, or a child who is also wheezing or producing any abnormal sound while breathing may have concern for a respiratory illness. So to now what may cause these illnesses, again the etiology, or rather the causative agents are many, but 90% or a huge majority of them are caused by viruses. And then a small percentage are also caused by bacteria, and those bacterial infections can then complicate and become severe diseases affecting the lower respiratory tract.
And why is it that it's the children who are mostly affected by these, infections and viruses? Interesting
question. So yeah, we say children are vulnerable. Why? Because even after they are born, there are some parts of their body that still continue to evolve. So these parts of their body include what we call the immune system. And the immune system is what fights diseases and fights illnesses. So these parts of them are still in evolution, and that makes them very vulnerable to diseases. So that's why.
Okay. Could you name perhaps some of the common infections, especially with the upper respiratory tract?
Good, yeah. So the upper respiratory tract infections, you could visit your doctor and maybe you have a flu, some cough here and there, what we call common cold, when it's affecting the nose and there's a lot of runniness, we call that rhinitis. And then when it's affecting now the part I told you, the throat, the pharynx, we call it pharyngitis. So itis in medicine means inflammation.
Okay.
Inflammation means swelling and leaking. Okay. So that's why your nose is leaking. It's leaking of mucus. So we call that rhinitis. Your throat is red and hot and it's aching and it's leaking. We call that pharyngitis.
Okay.
You get it? Yeah, so if it goes down lower below the pharynx, that the part we call the larynx, again, sorry for all the anatomy, we call that laryngitis. So again, it's inflamed, it's swelling, it's leaking. And what is leaking at this point is mucus. Okay. So just to name but a few, in the upper tract, those are the common ones. Common cold, basically, that's how we refer to it in layman language, but just specific for the parts that it affects, that's what we would call them.
And is there a difference between common cold and a flu, or it's just one and the same thing?
That's
yeah.
I stand corrected, but I don't think there's a huge difference. Rather, it's how we commonly refer to it as possibly being caused by influenza. Influenza is one of the viruses that would give you common cold symptoms, but then it has evolved and can also cause more severe illnesses. But there's no difference. There's no major difference between common cold and what we ordinarily call flu.
So do all these, infections share, the children present the similar symptoms for the three that you've mentioned?
Yeah. So for the three that I have mentioned, the symptoms may evolve more so to just look like the same, like in a blanket format. And the symptoms I'm talking about basically, because I said that there's a lot of leaking and a lot of irritation. So because of that, we will have symptoms of a running nose. Because of that, we will have symptoms of maybe an itchy throat, sticky throat, coughing, sneezing, and all this is meant to try and eliminate all that mucus that is being produced. There may be a lot of inflammation, especially around the throat. Their tonsils may get swollen as well.
Okay, so pharyngitis is the ones that the tonsils are aching?
Yes, and they may get swollen so much as the child cannot feed. So now these are other, we call them constitutional symptoms that are related, not necessarily to the eliminating event, but just because of the virus stroke the bacteria. So they may have fever, they may have refusal to feed, they may just have general, they are just lethargic. They just don't want to do anything. A child who is very, very playful, you'll hear the parent saying, this is just not my child, doctor. So that's also a sign for us, a sign for illness.
Okay, and do these illnesses, only affect children? I know we are focusing on children, but are there other people who are at risk of, getting these infections?
Yeah. So in general, they don't only affect children. They also affect, it's a whole spectrum, from children to adults. As a matter of fact, mostly children will get these infections from, as much as they get it through each other, mostly they also get it from adults. And since adults have stronger immunity, the disease may not manifest so aggressively in them as it would in maybe a 6-month or a 3-month-old baby. Nonetheless, we usually say that a child under 2 or between 0 and 5 years will get an average of say 3 to 8 or even more if they're going to school, upper respiratory tract infection. So sort of just to create, to help the parent know that this is actually normal, that now this is maybe the second runny nose we are getting. Don't panic, don't start removing the child from school. That will happen. An average adult, I don't know how many flus have you gotten?
Well, not This year,
still
God
young.
has been
Last
grateful. Yeah.
Maybe 2 to 3. Yeah, so of course there are populations of adults that are also at risk, and these are pregnant women, because obviously pregnancy is an immunocompromising state. Older people, the elderly, or people with other specific illnesses that affect their immunity, like diabetes or chronic diseases like cancer.
Okay.
Yeah.
All right. And when does a child stop being so susceptible to these infections? Is there an age that they'll get to, and then now the number of times that they're getting these illnesses reduce?
I may not have the specific answer for that, but can we modify the number of times a child can get ill? Yes, we can. Number one is at least between the age of 0 to 6 months, we say breastfeeding helps reduce upper respiratory tract infections by 60%. And that's huge. Yes. That's huge. So you'll find breastfed babies literally because of all those good immunity that they've gotten from the mom's breast milk. They hardly get ill, and even when they get ill, the milk already has tuned to treat them, if I may say so. So it's sort of a protective mechanism. Other things that may help, protect them is good nutrition. Good nutrition is key to good immunity.
All right.
Number 3 would be hand washing. Hand washing is very underrated, but remember, these infections are spread through, we call it droplets infection. And so when you have droplets of like, let's say I have an infection. Yes. And I'm talking to you right now. I'm spitting some things. Some things will land on this table. They will be on my hands, especially because I may sneeze into them. Yes. I may touch my phone. So all these formats, if a child touches or comes close to this kind of droplets, they are likely to get the infection. So if I wash my hands, it also reduces the rate of infectivity. But ideally up to around 6 years, then you should start seeing a decrease in the number of episodes that the child gets per year.
Oftentimes these infections comes with a fever, and you find a child has a fever at night. How would you advise a parent to go about it before they see a doctor?
Yeah, so as we said, most of these upper respiratory tract infections will be caused by viral infections. And the reason we emphasize this is so that we don't misuse our antibiotics. So we encourage that if the child starts showing signs of, runny nose here and there, coughing, poor feeding, but still the child can feed, the child is not refusing to feed, there are things that you can do at home. Like, it's okay to have fever medication at home. And this fever medication will be given by a pediatrician or a doctor and guided on how to give it. Usually most of them we will say give at least every 8 hours for the first 24 to 48 hours. Okay. If you do not see a change, then come to the hospital.
All right, Dr.
Yeah.
Okay, I'd love for you to hold on to that thought as we get to our first commercial break. When we will be back, we will now get to hear from Dr. on some of the lower respiratory illnesses. Do not go too far, but first take a look at some of the myths and facts of the day. Inhalers are not good for children. Inhalers can be used appropriately with guidance from the doctors to control asthma. There is nothing you can do if your child gets a flu. If your child gets sick, see a doctor to discuss treatment options. Prescription antiviral drugs can make the illness milder and prevent serious flu complications.